My name is Renee Golson, and I'm an independent consultant with Rodan+Fields. Today, I'm going to show you how to use the acute care strips. These strips are really revolutionary because they use peptides and hyaluronic acid to fill in the wrinkles around your face. Now, it's really important that you have your moisture content in your face be elevated. And so if you have not been using products that moisturize your skin, and hopefully you've been using Redefine or one of the other products from Rodan+Fields, if you haven't been using those for about 4 weeks, I would suggest that you do first because you're going to get more out of the acute care product and enjoy the results even more. So that being said, I want to take you through the steps of how I use it. The first thing I always do is I always cleanse my skin with something like Cetaphil. Cetaphil is recommended by doctors Rodan+Fields to take all the things off your skin, like the impurities, the makeup, anything like that, but it won't strip your skin of its natural oils. So I wash with that first, and then I pat it dry. I use Redefine, so I put the clay mask on number 1, I let it dry, and then I put on the toner number 2. I've done all that, and so now I'm at the point where I want to do acute care. Acute care is really amazing. It comes in individually wrapped packages. They're sets of pairs. And what I want to concentrate on today is I want to concentrate on the expression lines around my eyes. Now you can pick anywhere to put them. They're shaped like a little half smile. You can put them here. You can put them around your lips. The one thing they want you to know is that you want to use the acute care strips on the same wrinkle. You don't want to keep putting them all over because you really want to work on that wrinkle. There's 10 of these, 10 pairs in a box, and the whole point of using these is to fill in the wrinkle. The wrinkle should stay filled in for up to 4 months, give or take just a few weeks or days. But the one thing I really love about it is that it's using what your body naturally produces when you were younger, which is hyaluronic acid and the peptides. So it's natural stuff using the moisture in your skin to fill the wrinkles. So that being said, I'm going to put them around your eyes. You want to make sure that when you put them somewhere that you don't have any creams on your skin. So that's why I did the wash, and then I did the clay and then the toner, and now I'm going to put these on. After I put these on, then I can put any PM cream or night cream on. But I want to make sure it's not too close because I don't want anything to disrupt the adhesive that goes around the little patch. So I'm going to put them around my eyes. So I'm going to open them up. Oh, and one side note, if you have an AmpMD roller, this is the perfect time to roll. So if, let's say I'm gonna go right around my eyes, I wanna roll gently because I'm opening up micro channels, which allows the hyaluronic acid and the peptides to be more effective in getting to the deeper layers. So I'm gonna roll really gently because the tissue around your eye is really fragile. So I'm going to just open up these little micro channels. If you don't have the AmpMD, that's not a problem, but if you do, this is how you use it. So if I were going to be trying to work on any of my expressions as on my forehead or around my mouth, I'd roll those areas first. Rinse it, always put it back in its cradle to make your AmpMD last longer, up to a year if you take care of it. So now I'm ready to open up my package. Open it up. Inside, we call this gold because these little patches are designed to hold the hyaluronic acid and the peptides in them with cone technology. So I'm going to take them out. They look like a little band-aid, little smiley face. And on each side, there's little ways to peel them off. So when you peel this off, do not touch the center of it. Keep your hands towards the outside of the adhesive. I'm going to pull them off just like this. Just like so. And so I've got this little band-aid. And what I want to do is I want to do it around my eye here. So I'm going to put my little smiley face, and I have to look at the mirror to see what I'm doing here. I'm going to put it right there. And I'm going to wrap it around. And then I'm going to gently, gently kind of press the center because I want that hyaluronic acid to get in a little bit deeper. And I'm going to make sure that the adhesive is stuck all the way around so that at night when I sleep, it stays in place. So I'm going to do both sides. The biggest thing about this is you want to stay on the same expression line until it's filled like you want it. And if it needs the whole treatment, it's Monday, Wednesday, Friday for 3 weeks, and then the last week is a Monday because if there are 10, 3, 6, 9 plus 1. So keep it on that schedule. And so I'm going to put this one on too, and I try to put them symmetrical. It's easier said than done. You don't want to get in the habit of putting it down and then removing it again, because the adhesive is really wonderful. But you want to make sure that you don't wear it out by keep changing the position. And I'm going to gently kind of push in the middle just a little bit, very gently, and kind of make sure it's stuck. Okay, so I've got them on. I'm going to wear them at night. In the morning, I'm going to take them off. And you might see the rings of the adhesive for just a little bit, but they'll fade away pretty quickly within an hour. The other thing I can do in the morning is just do your natural regimen. You will notice after about an hour that the tissue is very calmed down, and you can look at those wrinkles. 85% of us in one treatment will show remarkable results. If you're not part of that 85%, don't be discouraged. That just means that you need to keep on the regimen for the Monday, Wednesday, Friday times 3 plus 1, and you're going to see a significant difference. You just need more time. So I found that the people who have younger skin, they tend to be more part of the 85%, but that's also just my speculation. Okay, so I've done that. I want to use some of my PM cream, which is number 3 PM, has a little bit of retinol. So what I want to make sure I do is I want to make sure that I stay away. I don't want to go too close to the border, because we know that creams on our skin travel about an inch as we sleep. So you want to make sure that you put them on, but not too close. Just like so. And my skin's a little red because this is the 3rd video I've made using the AmpMD, which has made my skin a little red. So I put on my night cream, spread it all over, and then I go to sleep. In the morning, I take it off and look at my expression line and say, hey, look, I'm making a difference. So take it off gently. When you go to peel it, hold the skin, give it a little bit of tension, and then peel it gently. Do not rip it off quickly. You don't want to irritate your skin, and you want to be careful, especially if it's around your eyes. That's tender, fragile skin. So be gentle when you remove it. All right, if you have any questions, reach out to me. I'm your consultant, and that's what I'm here for. Thanks so much. Have a good night. Bye-bye.